week, Governor Baker said he'll let cities and towns decide how to handle Halloween this year. And some places have already banned trick-or-treating door to door. Here to discuss the options with us is Dr. Kristen Moffitt, an infectious disease physician at Boston Children's Hospital. Good to see you.
Good to see you too.
All right, so what do you think of this grab and go candy left on the steps, maybe the end of the driveway? We've heard about putting candy on cookie sheets instead of in bowls. What do you think of all this?
Yeah, I do think the grab and go approach probably poses a lower risk than the traditional door-to-door approach. If you think about going door to door and street to street, that does involve closer contact, and that really involves an increased number of contacts. So that's the real issue there. The grab and go certainly would reduce the distance of the contact. The CDC website actually has some recommendations about how to safely prepare, like grab and go goodie bags, for example. And then if you were putting out individual candy, you could see how putting it spread out on like a platter or a cookie sheet could maybe theoretically reduce the risk of contamination if a bunch of people were reaching into a candy bowl, for example. So that does seem to make sense.
Okay, what about costumes? A lot of people might be looking right now. Should you look for one that has a mask or gloves maybe?
So it should be known that the Halloween masks, the traditional sort of plastic Halloween masks that come with so many purchased costumes, are not a substitute for cloth masks in terms of their effect of reducing transmission of COVID-19. So ideally, maybe a Halloween themed cloth mask that still is made of at least 2 layers of fabric and that still covers the nose and the mouth. That might be an effective way to sort of do double duty in that sense. In terms of gloves, I think we get a bit of a false sense of assurance that gloves are adding some layer of safety, when in reality, probably just frequent hand sanitation and hand sanitizer is still your best bet there.
Okay, all right, good to know. So the CDC now says that coronavirus can spread through those tiny aerosol droplets, and this caught our eye, some traveling more than 6 feet. So do parents need to perhaps reconsider some of the situations their kids might be in, things like being on a school bus or maybe indoor sports as we head into the winter months?
Yeah, I think the statement from the CDC really confirmed what we had suspected for a while based on some documented transmission events. But what it really practically means for families is not all that different than everything that's been recommended to prevent respiratory droplet transmission. So still, masking and physical distancing are of critical importance for preventing even aerosol transmission. But what is added is even more importance of ventilation, particularly in indoor settings. So that's where aerosol transmission could really become an issue. So I think in each of those settings, families just need to consider ventilation and need to consider all of the other risk mitigation measures and whether those are going to be adhered to.
All right, makes sense. Keep it, look at it in the big picture. All right, last question here. Boston's positive test rate now above 4%. That's raised a lot of alarms. Are you seeing any more pediatric cases at Children's? And if you are, do the patients have anything in common?
So pediatric patients are making up more of the population of COVID cases in Massachusetts. People under the age of 19 accounted for the second highest total number of cases over the last 14 days in Massachusetts, behind only the 20 to 29-year-old group. And we are seeing a bit of an uptake in pediatric cases here at Children's, but that's not necessarily been associated with an increased number of hospitalizations. And in terms of whether any of these cases have exposures in common or features in common, it's a little too early to tell, and that will largely come from the contact tracing that's being done by state and local departments of public health, but will be really important for us to know.
Yeah. All right, well, it's good to know that you're watching it too. A little assurance there. Okay, Dr. Moffitt, thank you for your time. We appreciate it.
Thanks for having me.